Hey, what's going on, everybody? What's going on? For those of you who are new to me, my name is Eric Capehart. And in the past, you may have known me because I have promoted myself and been operating as an expert mentor for the last 10 years. And so many of you know me because of my work as an expert mentor. But anyhow, my name is, again, Eric Capehart, and today I am going live on testing out this new technology here. YouTube has enabled us to be able to go live and share information with people all around the world. So I'm just going to try out a new thing today. Just a little bit about who I am. Again, my name is Eric Capehart. I am from Nashville, Tennessee, and I'm actually a mental health professional right here in Nashville, Tennessee. I'm currently I'm currently in the process of finishing my master's degree in professional counseling at Liberty University. I'm currently practicing under supervision at the Ross Center in Nashville, Tennessee. And I've been an active member of the American Counseling Association for the past 2 years, and also a member of the American Association of Christian Counselors for the past 2 years as well. So what is this video all about? Today, it's all about sharing the message that April is National Counseling Awareness Month. And Counseling Awareness Month was started by and continued to be held by the American Counseling Association. So every year, members of the association are encouraged to share with people in our social media about the importance of having a counselor, a mental health counselor in your life, because, we tend to focus on our physical health, and then we kind of slack off a little bit when it comes to our mental health. And as I always tell my clients, and even just friends and people that I'm talking to, we have to get into an understanding that our mental health is just as important, if not more important, than our actual physical health. And so that's why months like this and National Counseling Awareness Month is an important thing to do. And all this month, I'm going to be sharing tips. I'm going to be sharing tips on how to train your brain so that you can be able to, find relief from many of the common mental health issues that are taking place in our lives every day. So a brief introduction or a brief overview of what I'll be covering today. Today I'll be introducing you to some relaxation techniques that you can use that will enable you to better manage your stress. All right. I'm going to be teaching you about the acute stress response, which is also known as our fight or flight response. Say that 10 times fast. Fight or flight response. Fight or fight response. So I'm going to be teaching you about the fight or fight response, which is our reaction, our body's natural reaction to a perceived threat, whether that threat is real or whether it's something that's just playing in our mind that may not be real. I'm going to teach you a little bit about the relaxation response, which is actually, may not be technically the opposite of the fight or flight response, but I'll get into that. And so I'm going to be teaching you a little bit about the relaxation response. And I'm also going to teach you, talk to you a little bit about when you should use your relaxation techniques that I'm going to be covering all this week. All right. So just so you know, I'm going to be sharing all this information that can be found online at therapistaid.com, which is a great tool that I use when I'm helping my actual clients, because it's a great resource for therapists who are looking for worksheets, interactive guides, and just other tools that will help our clients live their absolute best lives. And so what I'm going to do is I'm going to do a little screen share here. I'm doing some new stuff here using this technology. And so what I want to do is I want to introduce you to relaxation techniques. You should be able to see this on your screen right now. And I'm just going to read. As you can see, I'm right here on therapistaid.com. Again, it's a great tool that I use in my practice every day. You can see here there's worksheets, interactive tools, guides, videos, articles, and other things that help us who work in the mental health field. You can see here just an overview of everything that I said I'm going to be discussing with you today: the fight or flight response, the relaxation response, when you should be using these skills. And we're going to be learning how to and talking about how to practice a specific relaxation skill today. I'm only going to focus on one, which is deep breathing today. It's a great tool that anybody can use. I mean, anybody can do deep breathing. And so what I want to do is get into an introduction about relaxation techniques. And I'm going to be reading straight from this source, and I'll be going back and forth from a live video of me where you can see me, and also sharing this information so that you can read it, because I know sometimes some of you are visual learners and you need to actually see this content, which will help you, which will help this information stick with you. So getting into it. So introducing relaxation techniques. So as it says here, without basic knowledge of the stress response, relaxation skills will lack context, right? They will end up seeming like tricks that feel good, but they don't really serve a broader purpose. Keyword is tricks that feel good. That's the key word there, feel good. All right. And for this reason, I'm going to be doing some psychoeducation about what I said, the fight or flight response. And I'm going to be giving you some information about how to look at the symptoms of the fight or flight response. So in a brief explanation of what is this acute stress response, or the fight or flight response. And as it says here, you can read this. It says the fight or flight response is a reaction to perceived danger, whether that danger is real or not. Now, it's important to note that danger does not only apply to physical threats, but also emotional threats as well. I know some of you are probably dealing with an abusive relationship where it's not necessarily physical abuse, but it may be more so emotional abuse or verbal abuse. Either way, whatever type of threat that you are perceiving, that particular threat is going to trigger your fight or flight response. Here's a great example. The fear of embarrassment could trigger the fight or flight response prior to giving a speech. Okay, so let's look here. The fight or flight response prepares your body to confront or flee a threat by triggering several physiological changes or symptoms. I'm just going to pause and stop right there and come back to the live video and just share a little story with you about how this actually looks in real life. I actually have a personal story. Just last night, my wife and I, we had this, I don't want to say it was an argument. It was more so just a general discussion. And it was all triggered by a simple thing that happens in my house. So I'm just kind of disclosing some personal information here with you. So last night, I was in my daughter's room just checking on her. She was already asleep. I got home after she went to sleep. And so I just wanted to go in her room and just make sure that she was dressed appropriately. And what I mean by appropriately is I really try to make sure that my daughter's not dressed to where she's going to be too hot or too cold in the middle of the night, right? And so last night I went into her room, and you know, she never sleeps under her covers right now. She's 19 months old, and she never sleeps under her covers, right? So I just went over there just to check and see, you know, what was going on in her room. And of course, there she was laying in her bed, sound asleep, but not under her covers. And so it's kind of cool in my house at night, right? And so all I did, I just put the blanket over my daughter, and I went back into my room where my wife was. We were just kind of winding down and just kind of doing what we do at night, getting prepared for the next day. And so as I went into the room, I made a comment and I said, you know, I wish Ava would sleep under her blanket more often. And so from that particular comment, I really do think, and we were able to discover that me making that comment triggered my wife's fight or flight response. I'm not going to go too much into how, what triggered it, or go too far into what the issues are that we have in our home with that. But it was a perfect example that I didn't even realize until after the whole conversation was over. And, you know, me being a counselor, I like to process things. You know, I like to process what was said or what was done, and just kind of look at, you know, things that maybe I could have done differently, or just things that could have been handled differently. And so as I was processing our discussion, I quickly realized that my wife's fight or flight response kicked in. And the evidence of that was, you know, at first we were having a conversation. So she actually, once my comment triggered her stress response, she immediately, you know, she stood there and she was fighting it or confronting it at first. And so after a period of a few minutes, you know, where, you know, sometimes things can become circular, and when we're trying to just have discussions, she finally just said, you know what, I'm done. I don't want to talk about this right now. And so for me, that was her fight, you know, response kicking in, right? Can you see that? Can you see how when you are confronting something after your trigger has been, activated, our body has a natural physiological response, which is our stress or our acute stress response. And when that, when those things are triggered, that fight or flight syndrome kicks in immediately. And we can talk a little bit later about, is that a good thing? Is it a bad thing? I won't go too far into that, but what I will say is it's a natural thing. And so if you're ever in a situation where something that has triggered you to where you feel that this sensation in your body to where you either want to fight or confront a situation, not physically fighting, but confront a situation or flee from it, flight. When those things are triggered, it's going to be important for you to know how to handle those. And that's what this video today is all about. So let me go back here to my screenshot because I want to show you, I want to share with you some symptoms of fight or flight. These are very, very important. In mental health, we really can't do a whole lot if our clients are unaware of the things that trigger them. What are your triggers? What are the symptoms of the things that make this fight or flight response kick in? As you can see here on the screen, there are a few listed here. And so here are some symptoms that your body is going to tell you that, hey, I am experiencing something right now, and my natural response to either fight or flight is starting to kick in. And one of those symptoms is an increased heart rate. Of course, when you're into it with somebody and, you're going back and forth, depending on what it is and depending on what your trigger may be, you will instantly start to feel like, oh man, that heart rate is going, right? And you're doing everything you can to try to mask it, but your body is actually feeling your heart rate increase. And so that's one of the symptoms that's telling you that, hey, maybe my fight or flight response is starting to kick in, right? So an increased heart rate is one. Some of us start to sweat. You may start to get balmy palms, or maybe you might start to sweat under your arms or on your neck or your back. But, when that trigger is activated, for some of us, our response will be to start sweating, and that's letting us know that some anxiety is starting to rise in our bodies. You can see rapid or shallow breathing. You may have difficulty concentrating or thinking straight. You may start to shake, right? Or you may start to have tense muscles, and you're like, man, I'm all tensed up and keyed up because of something that somebody said to me. And so knowing what these symptoms are is going to be very, very important. Now, it's important to know, and I'm going to leave this up just for a second so you can look at it just another minute. It's important to know that although the symptoms of the fight or flight response are an important part of protecting you from danger, they can cause problems when they're too extreme, right? It goes back to what I was saying a minute ago. I can't necessarily and won't necessarily say whether this fight or flight response is good or bad. I will say that it can cause problems when that fight or flight response is too extreme, or even when they occur in the wrong situation. One final note on this is that many stressors, for an example, an exam, a presentation, or an argument with a partner, are easily made worse by our flight or fight response, right? So in my effort to try to better explain the fight or flight response, there's a well-known analogy or metaphor that is used to help clients understand this fight or flight response. And I'll say it this way. So it's kind of like our primitive, our primitive response, like, right? So let me pull this up here so we can see it. I don't want to give out the wrong information. So let me pull this up. So there's lots of ways to define fight or flight response, but one metaphor is the reptile brain, right? And so what the reptile brain is, it's when that primitive part of our thinking is kicking into full gear. That primitive part, what primitive is? That's our survival skill. Like the only goal that I have in this moment when my primitive thinking kicks in is I'm trying to survive. And that's like animals, reptiles, right? And so when that primitive thinking starts to take over, all higher level thinking is out of the question. It's all about thinking about this anxiety, and you're taken over by that. And all you want to do is survive. That's what your fight or flight response enables you to do. It enables you to have that ability to do what's necessary in order for you to actually survive. So when you're thinking about handling your stress, when you're thinking about whatever you may be going through that's stressing you out in your life, and if it's a situation where it's a verbal exchange between you and someone else, and you start to feel your body give you those physiological signs, the sweating, increased heartbeat, those types of things, when they kick in, that's a signal to you to let you know that, hey, I am experiencing rising anxiety, and I need to do something about it right in this very moment, right? So hopefully you are able to understand the fight or flight response that our body will naturally give us. Okay, so next I want to talk about the relaxation response. All right, and so like I said in the introduction, the relaxation response is oftentimes seen as the opposite of the fight or flight response, and it is what it says it is. Let's look at what it says about the relaxation response. So in opposition to the fight or flight response is the relaxation response. Now, as you might imagine, the relaxation response puts your body at rest, right? Simple. And it counteracts many symptoms of the fight or flight response, okay? Now, relaxation techniques are used to trigger this response. So that's what I'm going to be teaching you today. I'm going to be teaching you how to trigger your relaxation response, okay? Now, one note on this. Technically, the fight or flight and relaxation responses are not exact opposites, okay? Some of the symptoms are unrelated or even complementary to one another. However, in the case of relaxation versus anxiety, we can safely focus our symptoms that are in opposition, okay? So let's move on to when should relaxation skills be used. All right, so now that we've discussed the fight or flight response and the relaxation response, it's now time for you to learn how these concepts apply to your specific situation, right? So are you experiencing anger? Maybe you're experiencing some anxiety, some stress, or fear, right? Now, what symptoms do they experience? Well, let me ask you this. What symptoms do you experience when these emotions arise? Ask yourself, when you're experiencing anger, anxiety, stress, or even fear, what symptoms do you experience when these emotions arise? And again, the more insight you can have about your symptoms, the better. Because without the ability to recognize your triggers and warning signs, you may find it difficult to remember to even use your relaxation skills until it's too late. You may find yourself in a situation where your triggers have been activated and you're so far into it because you weren't able to know what was actually going to trigger it. And so you don't even think about using this particular skill that I'm going to be teaching you until it's too late. All right? So listen to this. Triggers and warning signs naturally lead into a discussion of when specifically relaxation skills should be used. Okay? So do you feel nervous in the mornings before school? Maybe. Or maybe right before giving a presentation at work, you might start to feel nervous. Okay? So I want you to know that not only will this conversation help you learn when to use your skills, it will also help you determine what skills are a good fit. Okay? So let's recap what we've learned, what we've discussed so far today. All right, here I am. So what we've discussed so far today, maybe you are skipped through some of this video trying to get to the meat of it. So what we've done, I've given an introduction to relaxation techniques, right? And I made a comment that without, basic knowledge of the stress response, also known as the fight or flight response, relaxation skills will totally lack context, and they will seem like something that, it's a good trick to make me feel good, but it's really not serving a broader purpose. However, I'm teaching you about these responses for a specific reason, and it will help you when you have these moments of where you're feeling this anxiety. All right, we've talked about the fight or flight response, and then talked about how it's a reaction to a perceived danger, whether that danger is real or not. We've talked about some symptoms of fight or flight, which are increased heart rate, sweating, rapid or shallow breathing, difficulty concentrating or thinking straight, shaking, and also tensed muscles, right? We've also talked about the opposite of the fight or flight response, which is the relaxation response. which is triggered, right? The relaxation response is triggered by using relaxation techniques, okay? Now, let's talk a little bit about when you should even use a relaxation skill, okay? Let's talk about when you should even use a relaxation skill. You want to use that skill when you absolutely know what your symptoms are. When you know the things that are going to trigger your fight or flight response, that's the absolute best time to use what we're sharing today. All right. And the reason is because triggers are our warning signs. The triggers are our warning signs that something is about to happen. So the better or more information you have about your own triggers, or the more knowledgeable you are about your own triggers, the better prepared you will be to use and benefit from these particular relaxation skills. So let's move into practicing relaxation skills. Okay. Now, therapy sessions, which we do, and counselors, you go into the office and you sit down and you that's what a session is, and that provides the perfect opportunity to teach new relaxation skills. However, I'm just teaching them to you right here, wherever you are watching this video. You may be in your room, you may be at work, you may be on the bus or train or plane, wherever you are. I am actually teaching you a new relaxation skill, right? And now it's important to know that you must get a few minutes of practice of this every single day. It's going to be hard for you to see the benefits or realize the benefits of these techniques if you're not practicing them on a daily basis, okay? So what you want to do is you want to be sure to practice this on a daily basis, and you want to make sure that you are intentional about practicing this next technique that I am about to teach you, which I'm going to go back to my screen to introduce to you a technique called deep breathing. Now, this is a technique that I'm actually using with clients today. When people come in with anxiety issues, maybe it's a PTSD diagnosis or some type of adjustment disorder, deep breathing is a really good and easy technique to teach clients and even teach yourself how to do. What this says is deep breathing is one of the most versatile and easy to use relaxation skills. Who doesn't want something that's easy to use to help you better manage stress? So why not do deep breathing? So here's why deep breathing works. Right here, it says the fight or flight response triggers symptoms throughout the body, including rapid and shallow breathing, right? We talked about those symptoms. Now, deep breathing works by deliberately taking slow and deep breaths, which reverses the symptom and triggers a relaxation response. Now, when taking deep breaths, our bodies are able to exchange carbon dioxide for oxygen, which results in a slower heart rate, lower blood pressure, and consequently a feeling of relaxation. In addition to altering the body's flow of oxygen, deep breathing acts as a form of distraction from the source of negative emotions. That is very powerful. You need to know that. I will even say that again, and I'm going to bring it back so that you can see me telling you this very important thing that you need to know about deep breathing. Deep breathing acts as a form of distraction from the source of negative emotions. If you are experiencing any negative emotion about anything going on in your life, you may want to try this deep breathing technique, all right? Deep breathing is similar to the old idea of counting to 10. When you were young and maybe you were getting in trouble and you were just angry, or you were just emotional, you were expressing that anger emotion, and you were told to just count to 10, and then everything will be fine. You go and you say, okay, 1, 2, 3, 4, right? You're counting to 10. Right? And even when I was just doing that, I noticed myself breathing more. Maybe that's why they tell us to count to 10, but that's what deep breathing is like. It's like the old idea of counting to 10, but it has many other helpful benefits that are thrown in, right? So I'm going to go back here because this is something that I want to show you. And this is how to use deep breathing. So this is the part of the video where I'm going to actually teach you how to use deep breathing. And if you want to, you can practice this along with me. It's totally up to you. And I would encourage you to practice this to give yourself, some practice on how to do deep breathing. So here we are here, how to use deep breathing. So first thing you want to do, and I am sitting in a chair, is you want to sit back in a comfortable position, right? Get yourself in a comfortable position. Move this a little closer. You can close your eyes if you want to, but it's not necessary. Now, here's a little tip. Now, when learning to use deep breathing, try placing one hand on your abdomen so you can feel it rise and fall with each breath. Now, what this does is it gets you in the habit of taking large breaths and filling your lungs, okay? So I'm going to go through these steps. I'm just going to read them first. Then I'm going to come back live and show you how to do these steps. So step 2, breathe in slowly with your nose, right? Now, when you're breathing in slowly through your nose, you want to make sure that your inhalation lasts about 4 to 5 seconds, right? You don't want to go too long. You don't want to do too short of a time. You want to get about 4 or 5 seconds, right? And it's even fine to go a little bit slower if you prefer, okay? Now, step 3, you want to hold the air in your lungs. Once you've taken that inhale for those 5 seconds, you want to hold that air in your lungs, not to the point to where you're straining your body, straining your lungs, or feeling dizzy, but you just want to hold that air in. And I'd say about 4 to 5 seconds is a good target to aim for. The key here is what you want to do is you want to hold that air in for the same amount of time that you inhale that air. Okay, we'll show you that in just a moment. So step